Hey, Dr. E.
Hi, Brandon. How are you today?
I'm doing good. Are you ready to answer some teen related questions from our audience?
I absolutely am. Bring it on.
Okay, let's start. Let's just get right into it. Question number one. I have an 18-year-old son who is completely silent everywhere. He used to speak and then faded from speech starting around second grade. I've never met another kid with SM or a parent with a kid with SM. My son has no support at all at home. Are there any resources you recommend I check out and pass along?
Thanks, Brand. This is a great question. There's a lot in this question that can be talked about. We could probably spend the whole podcast on this question alone. Number one, we know nothing about this boy here. In other words, has he had a full medical, psychological evaluation, a neurological evaluation? What have you done in terms of understanding why this child of yours hasn't spoken in 11 years? Is there something that led up to that prior to him fading from speech? Did he have symptoms of selective mutism, social anxiety, any other Ys of SM that may have led to this? What else may have been going on? For an individual to not speak anywhere for 11 years, that's a really, really long time. So this child needs he's not a child anymore. He's 18 years old. He's a man, basically. Needs a full evaluation to determine what other things may be going on. Maybe this is just psychological. I don't mean to say this is only psychological, but there could be medical reasons why an individual at 7 years of age slowly fades from speech. It wasn't like there was an abrupt change. You clearly stated faded from speech. I am not by any means saying that your child is on the autism spectrum, but we do see language fading times in individuals. Does he have signs of autism? How is he functioning academically? How is he functioning socially without speech? How is he communicating his needs? Even though he's mute, is he basically appropriate in his communication in terms of nonverbal engaging other than speech? So again, I don't know these answers. I don't know. You said he has no support locally at home. I suggest that you look into specialists that have an expertise in selective mutism. You can go to selectivemutism.org, the Selective Mutism Association, and look for specialists in your area. You can also look for clinicians that offer telehealth in different areas of the country. Maybe your state is one of them. I do think this individual needs to be seen by somebody with an expertise. At least at the Smart Center, we do something called the Selective Mutism Evaluation, which is we look into, the whys of SM, the stages. Obviously, he's mute everywhere, but what may have been going on in his history to begin this process. Here's a big question. Does he have the ability to speak at this point? Or is he completely mute and doesn't have the ability to speak? So I think all of these things have to be kind of investigated. Also, does he have a motivation to speak? Is he in his room all day? Does he have individuals he communicates with non-verbally? So he has friends. I don't know any of these answers, but these are things I'd want to know to be able to help him. If he's completely mute everywhere, but he has the ability to speak, that he wants to speak, that he's a socially kind of appropriate individual other than mutism, and that he doesn't have any medical or neurological difficulties, and he's functioning basically at age or grade level. There are things we can do for individuals who are stuck but have the ability to speak. It sounds like he's stuck in the nonverbal stage of communication. And there are strategies. For example, the ritual sound approach, where we shape sounds into words. I have worked with countless individuals, adults as well, who have not spoken for many, many years. But again, they have to have the ability to speak. If they're on the autism spectrum, they have the ability to engage and participate in this. And again, I don't know that with this son of yours. So what I would say is a full evaluation by somebody with knowledge. And it may mean that you need to repeat some evaluations. Often evaluations, unfortunately, could be misinterpreted or incorrect if the child was shut down and not able to participate. And maybe it was seen as he doesn't have the skills, but in reality, he does have the skills. So I think what you're getting from me, this is a loaded question. It's difficult with teens because there's so much in their background that we don't know that needs to be determined as a first step. And then from there, we can move forward. And hopefully he has some motivation for change and he is functioning appropriately for his age other than his mutism and not speaking. And we can work with that.
Is this a good time to bring up that the earlier you seek treatment, the better?
Absolutely. It's difficult as individuals age because behaviors become very conditioned. In addition to that, the whys of SM that may have been factors into, the factors into why an individual developed SM are also why they're being maintained and SM is being maintained. So if that is not seen, it's difficult. So yes, the earlier the better. But what may have happened here is that this family may have seeked out resources, but wasn't able to get any help. And we do see that. We often see families who come to the Smart Center who have seen multiple clinicians over the course of their entire life, including the adults we work with, but no one was ever able to really peg this down and really figure it out. And sometimes those whys of SM, even having autism and SM, are overlooked or not seen together. They see behaviors as SM behaviors. But as I'm going to say to this question and many other in the future, SM being mute is a symptom. It's a symptom of other things going on, and we need to understand what else may be going on with this individual. When you mention that your son has not spoken for basically 11 years, at this point, because he is mute everywhere, he has more of a pervasive mutism rather than a selective mutism. And as I mentioned, with questions I'd want to know is, did he have a selective mutism where perhaps he spoke at home, but had a difficult time speaking in social situations such as school or out and about in the real world prior to this speech fading out? And that word fading out is really kind of a buzzword for me here, because fading out means it was gradual. And that's, a question I have as to why did he gradually stop speaking and how long was that gradual fading out occur, which again, I spoke about in terms of individuals on the autism spectrum can lose their speech at a younger age where it kind of fades away. And I don't know that his speech was appropriate language skills prior to second grade. There are families I work with who will say, yeah, my child speaks, but when you really investigate this through a speech and language eval, as well as questions that are asked to the parents, that at home he may only respond to choice questions, doesn't give elaborative initiative responses, or doesn't speak with elaboration and is not initiative, but mainly responds with a few words. To me, that is not appropriate speech. So again, I'd want to know those answers.
Okay, I think that's helpful. Let's move on to question number 2. My son has SM and has not talked in school for almost 2 years, but speaks at home. He is now telling me that he will only talk in school if he can change schools. He is currently in middle school and heading into 9th grade. Do you think changing schools is a good idea here? If so, should we consider special ed or a private school or a regular school?
This is a great question. What your son is feeling is that everyone knows that I'm the person that doesn't talk, and he feels that. So if he did start to talk, which by the way, most kids with SM don't just start to talk. There are some individuals that have skills, and when they do make a change, they can speak, but that's usually an individual that speaks in all situations, not just not speaking in school. In other words, they don't speak in school, but they speak everywhere else, out and about in the real world. They have friends they talk to, people, relatives, aunts, uncles, and it's pretty much isolated into the school setting. But again, I don't know that this would occur, and it's not as common as people think that just making that change works. It does for a few. Mm-hmm. I don't also know what else is going on with your son. Again, I keep going back to SM, social communication anxiety, or not speaking is a symptom, and we have to figure out what else may be going on with your son. When you mention moving to a special education school, what is the warrant for going to a special education school? Because they need to still have training on how to work with your child. At least at the Smart Center, we work with the child to help build the skills. We work with parents to train them. But we also work very, very closely with the school to provide appropriate school-based accommodations and interventions. If you're in a public school, you have the ability to get an IEP or a 504 plan to help your son in terms of interventions that need to be done, working with, let's say, a school counselor, a psychologist, a speech and language pathologist, etc. It really depends on the child and their needs. So I would be requesting an IEP or a 504. If they have an IEP or a 504 and they are getting trained by an expert in SM and your child is still not making progress, one, are they implementing those strategies and interventions and proper accommodations? And is your child participating? If you have a child in middle school, it's really difficult to treat a child with SM in middle school without any of their involvement. And I would say, what is their involvement and internal motivation? And sometimes using external motivation to help them working towards something they really need or want, privileges, etc. And really being very strict with your goals that you're working on, parent goals, child goals, coming back for therapy regularly. Do you have outside goals that are very kind of relevant to where your child is on the social communication bridge and what they're working on? Do they know what they're working on? So again, a lot of questions I have. And moving to a private school, although I'm an advocate of private schools for sure, I think there's a place for that. They aren't by law required to follow school-based accommodations and interventions such as an IEP or a 504. So if they're willing to provide accommodations, interventions, they tell you they are, and you meet with them and they work with your clinician to be able to put together a plan and they're willing to work with you, I have no problem with that. However, it may not occur. So you don't want to just make a move without knowing where you're moving and their vested interest in their ability, not just their interest. They may want to help your son, but maybe they don't have the resources in some of these private schools to be able to provide the accommodations, interventions that your son needs.
So in summary, it sounds like changing schools isn't necessarily the answer. It's more you're kind of dodging the issue, right? You need to focus on treatment, focus on progressing into speech versus just changing schools and
Right.
trying to almost avoid.
Yeah, no, I hear what you're saying with the hope that if I change schools, I'll just speak. But my question is, one, is your child speaking in a lot of other situations? Are they out and about in the real world with the goals that you're implementing to help bring them into social communication in a store, in a restaurant? Are they answering their aunt or uncle? Are they initiating questions when they need to? Do they have friends they already speak to and have a relationship with? Do they have those social skills? Do they have those communication skills? Are they verbal? Are they verbally responsive, initiative, elaborative? Do they have appropriate speech and language skills? So you can see there's a lot of questions I have. There are schools that, unfortunately, even a public school that has an IEP or a 504, they just may not have the resources or the ability to provide these accommodations, interventions. And in addition, perhaps your son is not an active participant in this. Middle school, they need to be an active participant. And if they're not, that's where you need to be working in therapy to help your son participate in this process and figure out what is it that we can do to help your son participate. And is there something that's being missed? Is it possible your son has some learning challenges, speech and language challenges? Is he on the autism spectrum? I bring that up because a child that is not participating in their treatment, that lacks internal motivation, like globally, being on the spectrum is something that we do see in kids like that, where they just have a difficult time planning out their goals and having that internal motivation for change. And what are your parenting skills? What are you working on? What is the accountability you have for goals that you're working on every week? If you're married or have a partner, is your partner participating in these goals? Are you out and about working on this in the real world? Is he having social interaction with other peers? There's so much here. Is he involved in clubs or activities outside of school? Is he speaking there? So you say move schools, but what is he doing outside of school now in terms of social communication?
I think those were all helpful points for them to consider. Let's move on to question number 3. I have a 15-year-old son with SM and social anxiety. We are from Latin America and have been in the US for 2 years. My son refuses to go to school and stays in his bedroom all day. How can I help him? What's a good first step?
I bet a lot of our listeners can hear this question and just how I answer a lot of other questions. they probably can kind of come up with some questions on their own as to what may be missing in this question and things that are going through their minds. For me, you said my son has been diagnosed with SM and social anxiety. Okay, that's great. And I'm glad to know that. We are based in Latin America, which means that they probably speak a native language that's probably different than what is being spoken in the school in the US. So let's say they speak Spanish at home. He speaks Spanish at home. The parents speak Spanish at home, but he's in an English speaking school. Now you took a child who is 15 years old. So he came to the US when he was 13, used to a culture, used to a language. And again, was he SM prior to coming to the US? I don't know that answer. Was he a socially appropriate, chatty 15-year-old boy, or even just, well, he has social anxiety. So chances are he had social anxiety then. But was he speaking in Latin America when he was there? Did SM develop when he moved here? Because the bilingual nature here of speaking another language at home, the cultural aspect of the native language, answering questions because he hears the, Spanish all day long, let's say. And now he's in a school where kids are having full give, take, elaborate conversations in English. Teachers are talking, and he's probably translating that. Maybe he may have gone through a normal, what we call silent period, where he was trying to kind of interpret the language, interpret the even nonverbal. Look, 90% of communication is nonverbal communication. Well, it's coming from a different country, how they, interact, even using their hands and the way they interact nonverbally is different perhaps now than it was in Latin America. So there's just a lot of unknowns here and things we need to think about. English as a second language would be something to think about as far as getting services. So we're talking about refusing to go anywhere and he's staying in his bedroom. A concern I have is that he's probably developed or developing depression, staying in his room. You have to have an evaluation. This is not something that I can give you an answer to. He needs to be working with a clinician. You need to be working with a clinician to help him, one, with lowered anxiety, but dealing with possible depression now. He's in his room all day. He's 15 years old. He may not have any friends. He's not going to school. He's becoming reclusive. This is very concerning. So your first step is getting help either locally. They don't have to be an expert in SM at this moment in time to help get him more functioning socially, emotionally, academically, and piggybacking that with a expert in SM who may be able to do it all, honestly, but that's what you need to do. He needs a full evaluation, and he also needs to be a participant in his treatment, as well as you having skills to help him be able to cope through, because he may even need medication. I'm not saying he does, obviously. I'm not doing a medication consult here, but a 15-year-old boy that's spending his day in his bedroom, refusing to leave, go anywhere, there's depression probably going on and worsening anxiety and social anxiety getting worse. It's really a concern at this point for his social emotional well-being.
So good first step is to seek treatment. Okay,
you
got
have
it.
Treatment and evaluation, and what this family may be struggling with is where to go. So again, you can try to find out local resources for somebody that has expertise in anxiety and seeing possible depression going on as to help him, and possibly medication to kind of ease the anxiety. Perhaps there's depression, to be able to then do the treatment to help him overcome SM. But if it's about a language thing, the language aspect is a really big part of this. How can you, if you speak another language and that's the language you speak in, even if you hear English and you know English, but the language you're speaking at home, your parents are speaking that your entire life and just got here when you're 13, it's really difficult to form friendships here if that's not the language you speak. So
even without SM.
Absolutely.
All right, cool. Let's move on to question number 4. I have a 14-year-old daughter who has social communication difficulties, sensory processing difficulties, and defiance at home. There are very little resources medically around us, and we have very little local support. What training do you recommend for parents to help and encourage their children?
Again, there are resources for you to read and learn. Again, selectivemutism.org or the Selective Mutism Association, the nonprofit organization. There's resources there. at the Selective Mutism Center, selectivemutismcenter.org. That's the SMART Center. On our resource page, we have tons of resources. We have webinars. Again, I mentioned
this podcast.
Well, of course. Yeah, I was just going to say Unspoken Words podcast is a great resource. Just listen to it in your car, even when you're going walking in your neighborhood. I mean, it's amazing how much you can learn just by listening to all the episodes. Honestly, there's things you're going to pick up. But I'm not hearing much here about getting your child evaluated. Very little resources medically around us. We are in the age of telehealth, virtual. COVID really sped that up. I mean, I spend 3/4 of my week doing telehealth with families as the other clinicians at our center. So working with a 14-year-old through telehealth as an option for treatment is something you should definitely consider. I don't know the state that you're in, but there are many, many states that clinicians have license in to do telehealth through the SIPAC. So you should absolutely go and seek a clinician that offers telehealth in other states. We do, and there are many others that do as well. So I think for you, that's going to be very important when you're dealing with a teenager, with social communication difficulties. I don't know if that means speech and language or the selective mutism and the sensory processing, having sensory processing difficulties. Typically with kids with SM and sensory processing, you see that highly sensitive nature, being in louder, larger, lots of people environments, a school classroom, out and about. That can overwhelm an individual, causes them to shut down and not be able to communicate. So it's very important to get support for sensory processing, working with a licensed OT that has skills in sensory processing. They don't need to be an expert in SM to help you from a sensory processing standpoint. Not saying again that your child needs to have medication, but medication may be an option. I do find individuals with sensory processing difficulties on medication, such as an SSRI, can be very helpful. There is research out that using an SSRI with sensory processing can help block out the extraneous sensory inputs, that it can really help them. So that may be something to consider to help your child. It'll also help lower anxiety to be able to do the treatment for SM, but you need to find somebody that has expertise. Your child is 14 years old. You may want to consider an intensive treatment, either individual intensive program where you can get a lot of parent education and support through the intensive individualized approach, as well as your child, and a step-by-step treatment plan. We do that at the SMART Center. You may want to consider an intensive group treatment. Some of the clinicians in the country offer intensive group treatments for teens. I know we do. We have a teen program at Communicamp specifically to help teens connect with other teens that feel as they do. It's that social identity piece. It's a all-day parent education and support program. So for 15 plus hours, parents are meeting other parents, learning from us, experts in SM, on how to help support your child. Lots of opportunities to ask questions, small group breakouts. So as far as helping you learn training, to me, there's no better option than an intensive program for you to get that. And a lot of programs offer financial assistance. We have grants to help families lower costs. We have local nonprofit that houses families at incredibly low cost locally to be able to attend the intensive group treatment, and in our case, Communicamp. So looking into different programs around the country and really talking to the different treatment providers, talking with them to be able to determine if that treatment approach sounds like that makes sense for you. Because it's really important that you identify with the philosophies of the treatment.
Yeah. Yeah. Now, I think an episode that this person could listen to and get a lot out of is that episode you did with Mindy Glass. That one has great tips on what she did as a parent to help her child overcome SM. And I think that could be a training in itself.
Yeah, just listening to the amount of, although that child was younger, listening to that parent, listening to Mindy talk about all that she did to set up the world for her child. As a parent of a 14-year-old, you can easily do that. Right. There's taking them out and about, setting up get-togethers, working with the school closely to do social buddies, groups, clubs, activities, participating in the world. and helping them engage in a way that's building their social communication confidence and progression across the bridge into speech. But I can't minimize the importance of parent education here to be able to support your child. You cannot treat a child without treating the parents. End of story. You just can't do it. It doesn't work. You have to train parents and train schools to be able to, one, accommodations, interventions, and tweak that process throughout the treatment. The same with the parents.
All right, let's move on to the last question. This one's a little interesting and different than the other four. Is there a link between multiple personality disorder and SM? My 17-year-old brother, out of the blue, stopped talking to his close family in late 2022. He also doesn't talk to anyone that a family member is close to, for example, my boyfriend. Yet he still talks to his close friends at school. We have taken him to many therapists and have done many tests, and we still don't know the answer. He also has severe OCD and anxiety, and he has told his therapist that there are different voices in his head that control his mind, kind of like the movie Inside Out. Have you seen anything like this before?
Wow, there is a lot here. I do not see a link between multiple personality disorder and SM. Can you have multiple personality disorders and SM? Absolutely. In the course of my career, how many times have I seen it? I can't think of when I have. I did have a case or a few cases where some of the older individuals had schizophrenia, which was part of their presentation, which they were hearing voices. But again, this is an outlier, Bran. I want to be very clear to our audience that there is not a link. I've never seen a link, and I would think my 35 plus years of experience would tell you if there is a link. When I come up with things like the whys of SM, the factors into the development and maintenance, yes, I've seen those links, which is why we studied those links. There is no link between that, but they can exist. I also would say, like, how do you know he has multiple personality disorders if all that's been said is that he hears different voices, which is a big deal? What comes to my mind just from that is schizophrenia. And being 17 years old, you can have signs of schizophrenia. So to me, I'd be looking into that. Now, the stopping talking in 2022 may have nothing to do with any of that. It may have been something going on over time. Sometimes when someone has selective mutism and there's a lot of push to speak or a lot of pressure, a child may stop speaking in his home environment due to that. Maybe there were changes. Maybe there were environmental factors that caused incredible stress in the home environment. A move, a family, again, multiple types of stresses, divorces, deaths, major changes. That can cause tremendous stress. I have seen individuals with SM stop speaking in their home environment, which was associated with the stressors, environmental stressors, pressures in the home environment, but speaking to friends in other locations. So family therapy here, or at least figuring out what might have been triggers into the stopping speaking. If his voices are telling him don't talk at home, then there's a schizophrenia component or another psychiatric disorder that needs to be figured out where he's being told don't speak. But again, that's not something I see. So I go the route of, is schizophrenia or another psychiatric disorder compounding this? Possibly. But I would try to break it apart and see what may have been occurring around 2022 or prior that may have caused him to be shut down and may have caused him to stop speaking in the home environment.
Yeah, it's an interesting question because it makes me think, is there like a teenager rebellious aspect to this where he's just like quote unquote hates his family and they don't understand him kind of thing going on here? Or is it linked with SM or linked with multiple personality disorder or not? What are your thoughts on that?
Well, I don't see the I want to just pull out the multiple personality disorder because I can't talk on that. I'm not seeing that here. I don't know what that is in terms of his presentation, what are aspects of multiple personalities, if they're basing it on the fact that he's not speaking at home but speaking everywhere else, and that's the basis for this perhaps diagnosis, or was he diagnosed with multiple personality disorder? Does that individual that diagnosed him understand what SM is, so that his multiple personalities are, I'm not speaking at home but I'm speaking everywhere else? No, I don't see it that way at all. And I'd hate to have that diagnosis if that's not truly the case. So again, I don't know. And I want to pull that out. Can teenagers feel misunderstood at home? Absolutely. I wouldn't use the term hate their family. It could just be feeling distant, disconnected. Did this family again go through some major life transitions? I've had situations where parents have gotten divorced. Another parent met someone new and they really didn't want to, they didn't feel comfortable with that person. They were living now with a new person that they didn't feel comfortable with, that they now stop speaking to. Maybe they have some or discontent with a particular parent. Again, I don't know. That has to be investigated. This is like throwing a lot of things in the air and trying to figure it out. I don't know. There's lots of questions I'd have for this family as part of the evaluation process, and helping him deal with what that might be and working as a family to figure out what else, could be dealt with in family therapy. I have seen a lot of that in families where the child just stopped speaking he wasn't old. In 2022, he was 15 years old. So what happened within that family dynamic that caused him to stop speaking in the home environment, but he is talking to his close friends?
Yeah. Yeah, it's an interesting question.
Yeah, there's something with the family there.
So family therapy is what you would recommend.
Well, just figuring out what is it. Like, he may not even know. So being able to learn what is it, and then the family's being receptive to, look, this child stopped speaking. There's obviously frustration on his part. Is there some rebellion going on? Possibly, but I don't usually like to see kids with SM kind of cornered into oppositional defiant disorder. You know me.
Right.
I feel like that's a really wastebasket diagnosis, and it's usually a result of their own inner frustrations rather than that's causing all this.
Yeah. I think that's helpful for the listener who asked the question. All right. Those are the 5 questions for this episode. Thanks, Dr. E, for your time. I'm excited to get this out for people to listen to and take something from. Any last words before we sign off?
Yeah, it seemed like an overwhelming theme throughout all of these questions is, where do I go for help? What do I do? What's my next step? I think that's important. And I do think families feel really helpless when they're looking locally for resources and they can't find them, or they're meeting with someone that really, it just doesn't fit. Like, the person doesn't really understand their child, doesn't understand selective mutism, doesn't understand the factors into what may be causing this child not to communicate. So I encourage families to really look on the internet, go to the Selective Mutism Association, tons of resources, look at Smart Center's resource page, think about virtual treatment, think about intensive group treatments where you can travel. I know costs are an issue for families, but most places offer financial assistance to families in need. There are lots of families we've seen with these exact presentations that have come to Communicamp and received that all-day parent education and support and have left with such skills. But in addition, the teens that were in this program met others that felt like they do. And many of these kids feel very, very isolated. We have to think about that, how isolated they may feel when others around them don't have this difficulty. They don't know anyone else. So that connection to other teens and dealing with teen issues that occur, and working through that in these intensive treatment, group treatment like a Communicamp, but also individual treatment.
Yeah.
But that connection that kids feel in these group treatments, I think, is just incredible. Frankly, the skills they're working with trained professionals that know how to help them progress. They help them acknowledge, assess their difficulties. They help them understand where they are on the bridge and what strategies are needed to help them make the progress. And so for even the very resistant individual, they let their guards down when they're told to in a specific way. And parents are learning skills that are helping them understand their child in a different way. I mean, something as simple as stop saying you should and need to your teen. That's just pushing them away. We teach you how to talk to them. We teach parents that. And I think that there's so many things that families can learn through these online resources and intensive group treatments that will help them feel in control, because they're feeling out of control makes their own anxiety worse. And what do you think's happening? They're projecting that fear and anxiety onto their children.
You got to do the work, and you got to make the commitment, and it starts with treatment, maybe even at Communicamp. All right, Dr. E, thanks again, and we'll talk to you soon.
Bye, Brandon. Have a great day.